Welcome to Health Professional Radio. I'm your host, Neil Howard. Glad that you could join us for another segment. In this segment, we're going to be speaking with Mr. Chris House, Senior Vice President in Product Management and Development at NantHealth. It's a healthcare company, and he's joining us here to talk about NaviNet. It's a payer-provider collaboration platform by NantHealth. And, thank you, Chris, for taking the time this morning and joining us here on HPR.
Thank you, Neil. Thank you for having me.
Well, as Senior Vice President of Product Management and Development at NantHealth, give us a brief background and tell us about this platform.
Sure. My name is Chris House, and I head up the Product Management and Development group for NantHealth. And one of the products that I work on at NantHealth is NaviNet. And NaviNet is our secure online payer-provider collaboration tool that we develop and sell to payers for providers' use. And we also have an AllPayer product that allows any provider to access over 1,000 different healthcare plans.
Now, when you say payer-provider, now how exactly do the providers use this pay-provider platform and the other way around?
Right. So the provider accesses the NaviNet portal to manage transactions with the payer, things like eligibility and benefits checks, claims, authorizations, prior authorizations, claim status checks. On the payer side, the payer provides us access most of the time to the payer back end to go get that data that the payer provides, such as eligibility and benefits, and serve that up to the provider.
Now, is this all, you say it's all done through an online portal. Is it all done via AI? Are there people sitting in some brick and mortar analyzing this data? What is the huge benefit of NaviNet? Sure.
Yeah. The portal itself is tailored to provider workflows. So we understand how the providers work. We've been in this business almost 20 years now, and we tailor our portal workflows to how the providers need to access that data. And when the providers go into NaviNet, they log in, and there's an easy navigation system in which we've incorporated where when the provider is at check-in with a patient, they can easily access E&B, and it's automatically goes out and captures that data from the payer and brings that back forward to the provider.
So they know exactly what coverage is provided and what other options are available based on each individual plan. And how many individual plans did you say that your platform accesses for providers?
Over 1,000 payer plans.
Now, are these plans that are specific to certain types of care facilities or treatments?
Right. That's a great question. No, we do not specialize in any particular disease state. We offer our products to all providers, and they're primarily used for, family doctors and open providers.
What about any dispute or misinformation that could happen within the analysis? Are there easy, claims resolution functions within that are?
Right. So as you can imagine, there's potentially a lot of friction on claims and authorizations. Those two workflows are extremely important to prevent, fraud, but also to ensure the right patient care. And our workflows and our tool sets for things like claims and authorizations, prior authorizations, are tailored to ensure that the correct information is provided to the payer to ensure speedy and timely delivery of service.
Of course, the COVID-19 pandemic has affected healthcare in, well, I guess still unimaginable ways. We have yet to see the full extent of this current situation. A platform such as yours in a time such as this, talk about how it's changed the way NantHealth is doing what NantHealth does, and talk about this platform as it relates to COVID-19.
Sure. If anything that we have really not learned but been reinforced for sure is that the payer-provider efficient communication is extremely important in time of crisis. And what we've seen from the COVID-19 crisis is, an overload of transactions, but also a lot of uncertainty on the provider side with regards to authorizations, what's required in this new disease state, what's required under these uncertainties, what payer policies are in place today to help address the COVID-19 crisis, and how those policies has been something that providers have vocalized to us, and something that we were able to help with in a big way with regards to helping them understand, obviously, eligibility and benefits, but also helping them feel comfortable that they're going to get paid for service, and that they're not going to either render service that isn't authorized and either get stuck with the payment, or unfortunately have to push that payment back onto the patient.
That I can't imagine the stress and uncertainty of that type of a transaction reality. How has NantHealth relieved some of that stress for payers and providers with their platform?
Right. Well, first of all, Neil, I have to acknowledge that one of the first things that we did as a company is just simply acknowledge the providers on the front line that are dealing with the crisis. Again, certainly in the early stages of this, there was so many unknowns with regards to how wide and deep this was going to go. And one of the first things we did was just humanize our platform, right? With the providers have used our platform for, as I said, almost 20 years. And it's certainly, they see it as a tool in their everyday life, in their everyday work life and workflows. But we wanted to put some people behind the tool. So we were able to use the platform to do something very simple. And just, we had staff hold up thank you signs, and we posted photos of our NantHealth family to the providers that are using our tool. So that was something I thought that, was really needed. And I think went a long way in helping providers know that, hey, NantHealth is here and we got your back. Some of the other things we did, we obviously have a fairly large medical staff, and our chief medical officers, Dr. Bobby Reddy and Dr. William Flood, have had a couple of webinars to help providers and patients understand how the COVID epidemic is transitioning, and some of the specifics around the data with regards to how severe it is, and kind of good tips to avoid obviously getting sick, and best practice. And then something a little more tangible that we did was we made our AllPayer product free for 30 days. So this is across the United States for all providers, including those that already were customers of our AllPayer product. They received the AllPayer product free, and then we allowed new providers to sign up for 30 days of free use, which was a small thing that we could do in order to, number one, alleviate some of the financial burden that we know the providers are having, but also allow new providers to use our tool set and hopefully get to that higher degree of efficiency using our NaviNet tool that maybe they didn't have experience with before.
Chris, where can our listeners go online and get some more information about NantHealth?
Sure. NantHealth.com is our corporate website, and there you can find links to our webinars and information regarding our COVID incentives programs, etc.
Chris, thank you for joining us here on Health Professional Radio.
Thank you very much, Neil.
You've been listening to Health Professional Radio. I'm your host, Neil Howard, in conversation with Chris House, Senior Vice President of Product Management and Development at NantHealth. Audio copies of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to the podcast on iTunes. Listen in, download at SoundCloud, and be sure and subscribe to our YouTube channel at youtube.com, Health Professional Radio.